Hey everybody, Dr. John, nurse practitioner with Island Direct Primary Care, and I am here with friend and colleague,
Dr. Paul Grimm, and I'm a doctor of chiropractic. Been practicing for the last 25 years, John.
25 years.
And
Practicing, huh? That's what they call it, practicing. But in reality, when we talk about healthcare, we often talk about the art and practicing of healthcare. It's not all just like Legos putting bits and pieces together, right? It's not set in stone.
No, I agree. I mean, I think what it comes down to is really what is the definition of health? I mean, what is truly health care? I mean, do we live in a country with health care? And I would say no.
I thought we weren't going to get in one of those talks when we started to do this podcast, but yes, right? I would argue the same thing, right? Do we really truly have health care or access to health care here in our country? And so,
I think we need to make what is the definition of health? Because really, at the end of the day, in the United States and most Western nations, what we have is crisis care. Would you agree?
Sure.
We wait until the symptoms, until we have some sort of pathology, something that we can measure, and that's our healthcare system, so to speak.
Sure.
And really, health is not really about the signs, the symptoms, the pain levels. It's more or less how is the body functioning.
Okay, so what you're really saying is healthcare is more than sick care.
Correct.
But we've kind of created a sick care society.
Correct.
Yeah.
It's much easier that way.
Sure.
Because at least in my practice, we are a corrective care office.
Okay.
So we want to get down to the root of the cause of the problem and not just kind of patch it over.
Okay.
Because a lot of times when someone comes to my office, say they have migraines, it's not like they have a lack of excedrin in their system, which is what's causing their migraines or their headaches. So then we've got to dig a little bit deeper and decide, okay, what is the true problem?
Mm-hmm.
I'm sure you see it all the time, John, where people have high blood pressure, they have diabetes, and it's not because they have a lack of high blood pressure medication in their system and why they have that. It becomes more of a health and lifestyle issue.
Sure. It's interesting because even in allopathic care, you're studying and they want to say use lifestyle first as your first intervention, but then you go to your healthcare provider. So we use healthcare provider as an all-around terminology, since there's physicians assistants, nurse practitioners, MDs, DOs, chiropractic physicians, etc., naturopaths.
Mm-hmm.
So you go to your healthcare provider, and in the traditional way, they go there and say, well, you meet the guideline for hypertension, so we're going to give you a pill, versus really spending time working on lifestyle medicine or lifestyle health to help decrease your blood pressure.
Well, I think now you're coming into integrated medicine or integrated healthcare,
which would be nice, right, for everybody if
Absolutely.
everybody had access to it. So,
I agree.
Full transparency, Dr. Paul is my chiropractor who I see actually at times multiple times a week.
Yes, correct. Correct. And Dr. John is actually my primary care physician.
Yeah. So, well, not a physician, but a nurse practitioner, but yes.
Primary care provider.
There we go.
Shall we say?
Yeah.
Is that better?
That's better.
Well, okay. So I think the real difference is when it comes to what is allopathic healthcare, and then what is healthcare providers in a more natural way, which is how we practice. And I think it really, if we kind of boil it down to what the big difference is, we believe that healthcare comes from within. We've got to create the environment for which the body to function at its optimum. It's kind of like you got to create the environment for it to snow. It's got to be cold enough. It's got to have the right moisture level in the air to snow. Whereas an allopath would say, healthcare comes from outside in.
Okay.
Right. You have whatever that may be. You have let's classify or name a certain issue that they have. Okay, well now what sort of medications or what can we do to intervene to get rid of those symptoms?
Right. And then in some cases, bacterial infection, right? You have a bacterial invasion from the outside in. You can do an antibiotic. Now, mind you, antibiotics aren't all pharmaceutical medications. There are other approaches to do that. But you have a bacteria from outside in. You have to rid yourself of the bacteria to do that. But when we get to overall healthcare, physical, mental, emotional, spiritual, some would even argue financial health, right?
Absolutely.
That often begins with the work that starts within.
Absolutely. So if you have a strong immune system, then that bacteria, we come into contact with bacteria, viruses, and everything else constantly. Mold.
We live in Florida, there's mold.
Yeah.
Sorry guys.
There is plenty. But so we come into contact with all these different organisms, and when our immune system works and functions properly, it's not an issue. Really, right? It takes care of it, does its job, and at that point, there is no issue. Now, I'm not saying that there isn't a time and a place for medicine, right? You know, if you're overwhelmed, if I'm in a car accident, you know, and I'm bleeding, I want someone to stop the bleeding. You know, I don't want an adjustment. Now, I will get adjusted after I stop bleeding, but there is a time and a place. So if your body cannot obviously fight an infection or it's overwhelmed, then we need some sort of antibiotic.
We need sick care.
We need sick care. So there is a time and a place for it.
Sure.
But I think, and it's my true belief, that it is overutilized, right? We have in this country a standard of health, or a standard of care. Okay. Right? So if you go to the hospital or you go to your typical medical doctor, you do this, you do this, you do this, you do this. From the most conservative to the most invasive. Okay. Right? For example, you go get your mammogram, right? Mammogram, can't see, it's inconclusive, you have dense breasts, okay? So now we have to go do an ultrasound, right? Now, if you know that from the beginning, then why would you do the mammogram in the first place when you know you're gonna have to go to the ultrasound, right? Why would you get the radiation? So why don't we just go straight to the ultrasound? But that's the way that the insurance company works it, and you have to go through the steps, or you have to go through the protocol.
Or the gold standard. That's the gold standard for that particular screening, if you will.
Correct.
You know, so what actually I think originally was derived to be a cost-saving measure, which should have been a life-saving measure, right? We can do things differently, and I think it should be relied upon the healthcare provider to actually make that decision. So I have plenty of patients who actually have hormone excess. They tend to have more fibrotic breast and these kind of things. We already know that when they do their mammogram,
it's going to be inconclusive.
It's going to be inconclusive, right? So why not just go straight? And so
cut out the cost, cut out the harmful radiation. So then let's just get down to the root of the problem.
And it's what I love about direct primary care. It's why we kind of founded Island Direct Primary Care, was because now we can, not circumvent what's necessary, right? But go straight to what's necessary in the most cost-effective way. But more importantly, that is safe and provides a high quality of care for our patients. And so we can just go look straight for the root cause. Now, not everything, finding the root cause is easy.
No,
and it's, because you know what? We didn't get there overnight.
No.
I think I just had a patient walk in before we had this thing, right? And I told him that I'm getting ready to do a podcast with my friend and colleague, Dr. Paul Grimm. And he goes, and he lifts up his shirt and shows me his back brace, right? And he goes, I need to get adjusted. Is he working today? And I'm like going, really? I go, well, that didn't happen just overnight. I go, but you know what? When you come back from your trip, then, schedule an appointment with Dr. Paul, because Dr. Paul's approach is to correct the issue just not snap, crackle, and pop and try to make me feel better.
Yeah.
You know, and I've been seeing you for a long time, so I know that.
Absolutely. Well, I think there's a big difference that, once again, people that you see and that I see, typically, when we see them, when they arrive in our office, they're in crisis, right? They've had an issue on and off intermittently. Now it's gotten worse, so it's a chronic issue, but they just happen to have an acute exacerbation of the issue. So, which obviously our first goal is, hey, let's get everything under control. Let's get it more manageable. Let's get you more comfortable so you can function. But what we found, at least I have found, and I'm sure you could probably agree with this, is over the last 25 years of practicing, is when we didn't correct the underlying problem, then the problem would come back and actually it would get worse.
Sure.
So it's, and that's obviously not what we want.
Right.
Because we want our patients to have the best life possible, to have the optimum health, to be able to pick up their grandchildren, to be able to walk and go to the grocery store, to live life and enjoy it. And,
sure.
and that's why we do what we do, because we love it.
Mm-hmm. I do love what I do.
Oh,
and you're absolutely right. So a lot of our patients that come to Island Direct Primary Care are in some kind of inflammatory or autoimmune type situation. So they've tried all these different modalities of care. Many of them have insurance, although we don't take health insurance. We're a membership-based practice. And they're like, John, we're looking for someone who will just listen to us, right? And so we see one patient an hour, and we spend time and we start digging and peeling back the layers of the onion, right? So we start peeling back that onion and we start finding out, okay, here, let's do this. Let's slow the acute exacerbation, get them to where it's tolerable, where they're able to function. But the work hasn't really started yet. And that's where things kind of tend to be challenging. And that's why I like working with you, because I have a number of patients now that, utilize, chiropractic care, particularly you, as part of their health care, because, you have traditional modalities. There's not one size fits all for everybody. You talk about acupuncture, naturopath, I mentioned a few minutes ago, chiropractic, functional medicine. You have, complementary and alternative medicine, right? I like to say we do integrated medicine. I like to kind of blend what needs to be blended and then refer what could be referred. So whether it's chiropractic care or acupuncture or something like that. And I think the long run that's the most cost-effective care, because people tend to be healthier working at a more optimal level, so living at a more optimal level for a longer period of time than previous, right? And so it's an investment in yourself.
Absolutely. But it's also something that it has to be a 50-50 relationship too, John. As you well know, it's like we can't do all the work for you.
You can't do my stretches for me?
No, I can't do stretches, so I apologize. So we have to work together with our patients. So we have to change things, because it's typically the lifestyle that they've led and the neglect that has gotten them into whichever situation that may be. Because really you have to invest in your health.
Okay.
Right? It's kind of like your retirement, right? It's like your 401k. If you never put any money in it, you're never going to get anything out of it in the retirement. And the same thing goes into your health, is you have to invest in it along the way, because it's going to reap rewards as we get older, and we're all going to get older. So I think that's what makes us much different from a lot of the medical doctors or allopathic type of healthcare, is that we want to work with our patients. And we want to be able to coach them and to advise them and really work with them, because we know that just taking a pill may make you feel better, but it's not really going to fix the problem. And
right.
That's not the way that we want to practice. We want to really truly gain real health, because it's a foundation. You have to have a foundation, and having an optimum nervous system, and to have truly functioning integrative medicine, and have that exercise and diet, I mean, that is really your foundation of your health. And when it's a rock solid foundation, then you can build upon that.
Right.
And that's what we're looking for.
Right. You know, it's interesting. So I'm going to be 52 next month. So don't hold that against me. I know, old and sexy. That's a typical rugby thing to say. What do you expect, right?
True.
So a month before I went to a rugby tournament a couple weeks ago, I'm just jogging, run a few sprints, hurt my back, threw my back out, and I come see Dr. Paul, right? And I'm like, hey, I want to go play rugby in 30 days. So I gave him a lot to work with, and this is what I'm getting ready to do. But interesting enough, the healing time is quick.
Yes.
Okay. I practice good nutrition, and so I had a good foundation, and my hormones are balanced, you know, for, you know, male my age. Started investing a little bit into some peptides, and I remember I was in upstate New York, and I'm like heading to my 4th match for the day, right? And I text you, and you're like, how's it going, John? How's the back holding up? And I'm like, I'm going into my 4th match. Like, you know, what are you thinking? But it was great. But I think what was more impressive to me as a person, we talk about optimal health. Mm-hmm. For over 2 decades, it would take me almost a month to recover from playing rugby. Mm-hmm. You know, when I was playing competitive rugby week on week on week, I would do it, but I never really truly recovered. Mm-hmm. This year, at 51 years old, I played rugby the weekend, and the following week, I was ready to play rugby again. I felt great, and I was pain-free. My shoulders, my back, my neck, and you know, I've been a patient of yours for a while, right? Absolutely. And so you've watched that. You remember when I've come back from some of my tournaments, and this time was totally different. And I think it's because we built that foundation, and then we maintained that. And that kind of takes me back to the patient that was just here. He's just like, well, I just want to go to a chiropractor today, and I kind of hit him up with you need to maintenance health, mm-hmm. right? Not just fix an acute issue. And so that's what I like about integrative care, is you kind of go past the sick care piece and kind of really focus on the health care so that you can have optimal life.
And I think it's all about wellness. Yeah. It's not about acute, it's not about symptomatic care, because when you already have the symptoms, that means you already have a problem. So I think what that just kind of illustrates is when you have that base, where when you're doing the right things, can you still injure it? Can you still trip and stumble? Of course you can. You know, I mean, because we're still under, you know, physical, chemical, emotional stress. Mm-hmm. So that's always, you know, on top of us and affecting our health. But when you truly have that health base, you notice that you bounce back a lot quicker.
Right.
You know, so your body has that capacity to you know, that elasticity to kind of get back to where it really should be. Whereas, you know, most people, when they get acute illnesses, mm-hmm. and you've seen it, you've worked in a hospital, it's like, it becomes really difficult. You know, people have big challenges if they don't have fuel in the fuel tank, so to speak.
Sure.
If they don't have that reserve, if they don't have that, now you're running on empty and you're fighting for your life. And literally. I mean, and it's not a pleasant place to be.
Well, and the downhill trend is much faster than the uphill build, yes. Right? And so it's kind of
you can only coast downhill.
Yeah.
Right? You only coast downhill. You don't coast uphill.
No. And so it takes work. Absolutely. Right? And so you're absolutely right. And once you get that momentum of going down, and look, guys, we all do it, whether it's through nutrition. You know, I'm going to do another video here shortly. I'm finishing a 4-day liquid fast right now because I'm doing a gut reset. Now, does everybody need to do a 4-day fast for a gut reset? No, some people 2, some 4. Everyone's a little different. Mm-hmm. But my point being is that even though from a health perspective, I feel better than I ever have, I still have to constantly build, renew, reset, support, build, renew. I mean, and so it's things that you have to continue. And if I don't do that, then one day goes by, and then 2 days goes by, and then 3 days goes by, and then it gets harder, right? Because now I've occupied that time that I normally spent for myself and my wellness, doing something different, and now I'm out of my routine. And so mindset, which we'll have to talk about at another time, but mindset, I think, really plays a huge part in what we need to do to kind of start setting that foundation and building on what was given to us.
Absolutely. I agree. I mean, you have all the bits and pieces.
Mm-hmm.
You know, you have, I mean, you were given that at birth,
Mm-hmm.
right? And so I think what people don't realize, or sometimes is missed, is that you have to work at it. I mean, it's just like anything else. You know, like your relationships with your spouse, your children, your health, your career, whatever that may be, you have to work at it.
Sure.
Because if you take it for granted, you know, you can do that for a short period of time, but then it really does come back to bite you in the rear end, and that's not what we're looking for. So, you know, that doesn't mean that you have to, you know, eat great every single day of the week. I mean, yeah, I mean, we all stumble and we all have that.
You go to the dirty or?
or you know, you have that, you know, like we have, you know, a pizza night where,
sure.
you know, you're not eating as well, but the majority of the time you do. So you can take, you know, little breaks here and there, but it's what you do most of the time that counts.
Mm-hmm.
It's not what you do some of the time that counts. Mm-hmm. So I think that's where really a stepping point off right now for this video is that it takes work.
Yeah, so it takes work, but it's progress, not perfection. So be on the lookout for more videos, podcasts from Dr. Paul and myself, Dr. John, nurse practitioner. And if you have any ideas on topics that you would like us to discuss, especially from an integrative health perspective, please put them in the comments below. Have a great day.
Take care.